A junior colleague on your team always takes his copy of the patient list home as there is no confidential waste bin on the ward. He says this also helps him prepare for the following day as he can memorize details in time for the consultant ward round. Okay. So problem in this question is that a colleague is taking patient list at home, which means that it is a breach of confidentiality. It is not allowed to take patient list at home or to look at the patient details back home outside of hospital. So this is a problem. So now we are going to read the answers and then we'll rank that which is the best one. Firstly, I'll read the answers. Tell him this is unfair as he is getting ahead and making you look disorganized by knowing patient details before the ward round. Option B, ask matron or a senior sister about obtaining a confidential waste bin. Option C, tell your colleague let your colleague know that he should not be taking a patient list home each day. D is speak to the consultant about your colleague's behavior. E is take your own list home so that you can be as familiar with the patient as your colleague. So the question, the problem is patient confidentiality, and a colleague or any doctor is not allowed to take the patient list at home. This was the problem. So, firstly, we will the best answer in this among these is the number one is C. Let your colleague know that he should not be taking a patient list home each day, because as we know that we should always deal with the person. We should always let the person know that this is the problem. So we should directly deal with the person first. So we are letting the colleague know that he should not take the patient list at home. So C is the best one. The next best option is B, that we are telling the sister or a matron nurse to provide a confidential waste bin at the ward. So this also solved the issues that if we have the confidential waste bin, that then patient list will be disposed of in the confidential waste bin. But there is a problem in this option. Firstly, it doesn't deal with the scenario immediately. There will be a delay in providing the confidential waste bin, and the other problem is that this option doesn't guarantee that that colleague will use the waste bin. So there are two problems in this question in this option. That's why it is not the best one. It's the second best one. Okay, so then the third best one is speak to the consultant about your colleague's behavior. This is also a good approach to escalate the situation to the consultants or to the seniors if we have some problem. But if we want to solve that problem with the person directly involved, like with the colleague, then we will escalate. So option D is actually premature escalation. So it is not the best one. It is the third best one. Okay. In the question, option A was tell him this is unfair as he is getting ahead and make you look disorganized by knowing patient details before the ward run. Like it is a sense of competition in this answer, which looks childish. So it is a wrong answer that we are telling him this is unfair only because we don't want him to be more organized or ourselves to look more disorganized. So it is a wrong answer. It is on the fourth place. Okay, so the last option, or the most incorrect option you can say is option E. This is that we take our own home list home. As we have discussed that the problem is anyone shouldn't take the patient list at home. So in the E option, we ourselves are doing the wrong thing. So least appropriate one. Okay, so we move to the next question. Question number two. A patient on your ward is HIV positive. He is from a minority community which he feels might react negatively if they knew of his diagnosis. As a result, he is very anxious that no one should be told. Okay. So here a patient is HIV positive and he doesn't want anyone to know that he is HIV positive. So it is our duty to maintain the patient confidentiality. So here the main topic in this question is also patient confidentiality. So we will read the answers and we will see that what's the best way to preserve the patient confidentiality. Okay, so the option A is eliminate all mention of HIV from his notes. Option B is amend your patient list so this detail is missing or obscured. Example, retroviral illness. Option C is ensure the safety of the patient other doctors and phlebotomists by writing HIV positive on blood requests. Option D is tell the patient that he should talk to his family as you cannot guarantee complete confidentiality. Okay, so option E is continue as you would do for any other patient under your care. The best option is option E. The patient is demanding confidentiality, although he is HIV positive, but he wants confidentiality. He doesn't want anyone to know about his situation. So option E is the best one here. That we are dealing him in the same way as we'll deal with any other patient who wants to maintain the confidentiality or who doesn't want anyone to know, as it is his wish that anyone shouldn't know about his illness, about his HIV positive status. So we are maintaining the confidentiality. Continue as you would for any other patient under your care. So E is the best one. The next best is option B. In this, we are also kind of protecting his confidentiality. Like we are not telling straight away in his list or in his notes that he's HIV positive. We are just saying that there is a retroviral illness. So it is also partially protecting the patient confidentiality. Okay. Um, and the option D is next option is option D. Tell the patient that he should talk to his family as you cannot guarantee patient confidentiality. This is wrong, as patient doesn't want his family to know, so we should respect his wishes. We should not force him to tell his family. And when exceptional case in this situation is that if it is directly, if his family involves his partner, so in that case it is his duty to tell his partner, but other family members is not obligated to tell other family members. So D is in the third place. Tell the patient that he should talk to his family as you cannot guarantee patient confidentiality. This is wrong, that we should not force him to tell his family. Okay, the other wrong answer is option C. Ensure the safety of other doctors and phlebotomists by writing HIV positive on blood request. Okay, so in this option we can think that we should let the phlebotomist and doctors know so that they could be more safe, or they should take the maximum precautionary measures. But but in the UK, any blood report or any blood samples are dealt in this way that the phlebotomists and doctors are protected. Means that they should deal every sample that it is a kind of high risk sample, or they should deal every sample as it is that it could be harmful for them. So they should be careful about every sample. So it is not necessary to mention HIV positive. One thing we could do in some trusts is that we could write high risk, but not specifically the diagnosis HIV positive. So it is not good to write the specific diagnosis on the blood requests. Okay. So option C is also a wrong one, and it is in the fourth place. So the last one is option A, eliminate all mentions of HIV from his notes. Okay, so we should not eliminate HIV altogether, as it will be risky for the patient and also for the doctors as well. If we will not, if we remove HIV from his note altogether, then doctors might not take him as seriously, or might not deal him as serious.
And we do
Yeah.
not change the notes as it is against the commitment to professionalism. Okay.
Yes, changing the notes is against the professions. You're sitting in the pub opposite your hospital after work. A group of doctors and nurses from another department is talking loudly and joking about the patient on their ward. These patients could easily be identified from the conversation you're overhearing. Okay, so in this scenario, again, the main theme is confidentiality, as a group of doctors is discussing about a patient. So obviously this is wrong because patient could be identified from their talk. So we don't want such conversations to proceed further. Okay, so main theme is confidentiality. Now we'll move towards the options and then we'll rank accordingly. Okay, option A, speak to the person who is speaking louder so he's aware that his behavior is inappropriate. Option B is call hospital security and ask them to intervene. Option C is challenge the whole group so that they are aware about that their behavior is inappropriate. Option D is contact a manager in the department and ask them to intervene. Option E is ignore the situation, as this should know as they should know better and you do not want to cause a scene. Okay. So let this conversation to end as soon as possible. So we will firstly speak to the person directly who is speaking the loudest. So it is easy to approach a person rather than a group. So we'll first approach the person. Option A is the best answer here. And then option C is that we'll approach the group and we will tell them that it is not right to talk about the patient as patient can be identified from their conversation. So the next option is option C. Okay. So the other one is option D. In this, we are challenging them that they were breaching the confidentiality, but we are doing this the other day, the following day, which will cause obviously a delay. That's why it is not among the best one. It's on the third place. Okay. Then the next option is option E. In option E, we are ignoring the situation as we don't want to create this particular situation is breaching the confidentiality. We want to intervene, we want to interrupt their conversation. That's why it's not a good option, it's a wrong one, option E. Okay, the last one is option B, call the hospital security. Okay. Calling the hospital security in this situation is not suitable, and if even if we ring the hospital security or we call them, they will be shocked that why we are um, calling them outside the hospital for a matter which is not directly under the discipline, that they are not required to stop such conversations. It is not their duty actually. So it is a wrong approach. Okay.
Okay.
Yeah.
So ask the person first and then group, and then you can just
Yeah.
contact the manager. And then the wrong, these two are the better. The worse answers are contact the manager, then situation. You can ignore the situation, but it's not solving any problem. And the most inappropriate is
Yeah.
just call the hospital security and ask them to intervene. Okay, the next fourth one.
As you arrive on the ward one morning, you hear a nurse in the side room shouting at a patient. The tone and language used are unpleasant. Okay, you know that the patient is elderly and has severe dementia. Okay.
Hmm.
So, in this situation, a nurse is shouting at a patient who has a dementia. So, we don't want such a situation to proceed further. So we want we want this shouting of nurse to end as soon as possible, and we want to maintain the patient dignity. Main theme in this question is patient dignity. Okay,
Hmm.
so we want to just stop this shouting of nurse. Okay, so how we'll approach, there are five options. I'll read, then we'll rank accordingly. Okay, the first one is knock on the door and ask to speak to the nurse, speak with the nurse. Okay. B is discuss the issue with the senior nurse matron in the first instance as soon as they arrive. Okay. Option C is make preliminary inquiries from other staff working that night to ask if they have noticed inappropriate behavior. Okay. D is use body language to show your disapproval, but do nothing formally as patient safety is not at risk. Okay. E is contact the care quality commission anonymously to avoid raising the issue and employees of your trust. The best one in this is option A. As we have discussed before, that we want to end this situation. We don't want nurse to keep shouting, as this is like this is a threat to the patient dignity. Her dignity, she's a dementia patient, elderly patient, and her dignity is compromised by this situation. So we will immediately knock at the door and ask to speak with the nurse who is shouting. So A is the best answer. Okay, the next one is B. We will, because a nurse is talking, so the best approach is, the good approach is to talk to her senior and tell her about the situation, so she can intervene and stop the nurse, but this will cause a delay. That's why firstly we ourselves are stopping the nurse to speak to shouting at the patient. And the next one is B, we are telling her matron, her senior nurse, um, that when she arrives, but this is causing a delay. That's why it's on the second place, not on the first one. Okay, the third place is of option C. In option C, we are inquiring about the other staff, that about inquiring from the other staff about the behavior of the staff who is shouting. Make preliminary inquiries from other staff working that night to ask if they have noticed inappropriate behavior. This option is not solving anything. Like we are not um, protecting the patient dignity in this situation. We are just investigating that about the nurse's behavior who is shouting. So this is not solving anything. It is kind of a neutral option. So it is on the on the third page. Okay.
Mm.
Okay. It is neither wrong, neither right. It's just a neutral one. So it's on this third page. Okay, so the wrong ones, now we are moving towards the wrong ones, which is the option E, which is in this we contact the Care Quality Commission anonymously to avoid raising the issue with employees of your trust. Care Quality Commission is an external body, it has nothing to do with the hospital situations. So the best thing we can do is to solve the issue internally rather than including the external bodies. Okay, so E is the wrong answer, and D is more wrong than E, because in this we are just use body language to show your disapproval but do nothing. In this we are doing nothing, we are just showing with the body language, but we are not practically doing anything. So it's a wrong one.
Yeah,
Okay,
that's fine. Yeah, that's fine.
ignoring the situation. Okay.
Okay, next one, 5.
5 is you begin induction at your new trust and are asked to sign a number of agreements. One of these, there is an agreement never to raise concern with bodies outside of your employing organization. This is a condition of taking up your post. Okay. So it is our obligation to raise concerns if there is a concern ongoing in the hospital that we feel is not good, or it not protecting the patient safety. So it is our duty or our obligation to raise concern if we find something. But in this situation, we are about to take a post which says that we should never raise a concern. So this is not good. This is against the good medical practice. Okay. So the problem is that we are forced, or we are assigned to sign up for a post which says that we should not raise concern with the bodies outside our employing organization. So this is wrong. Okay, so what I'll tell about the options. We'll read the option, then we'll rank that what is the best action to do in such a situation. Okay, option A is sign the form and begin work as instructed. Okay, B is throw the form away and hope that no one notices that it was not returned. Option C is explain that you cannot sign. Uh, just a minute. Okay, explain that you cannot sign as this prohibits you raising concerns appropriately about patient welfare. D is sign the form but resolve to raise concern about patient safety in whatever way is necessary to ensure their resolution. E is contact your medical defense organization or the GMC for advice if in doubt. Clear that we should not sign the form because it is not good to because we have the obligation to raise the concern, and they are telling that we should never raise a concern, so we should not sign such a form which is against the good medical practice. So the best option is option C, explain that you cannot sign as this prohibits your raising concerns appropriately about patient welfare. Okay, so the straightforward thing is that we should not sign such a form. So C is the best one. Then we'll move towards the option E. As I told you that this whole trust policy is against the good medical practice, uh, that they are preventing the doctors from raising any concerns. So we should we can involve the higher bodies, because outside the trust, like we can contact the good GMC or the medical defense organization, and we can take advice from them what to do in such a situation. So E is the second best one. Okay. Next, can you please show the question? Yeah. Then option next one is the option B. Option B is throw away the form and hope that no one notices. This is also not good because we are not being honest. We are just throwing away the form. Although we are not signing, we are doing one good thing, that we are not signing. But the wrong thing we are doing here is that we are hiding that we are being dishonest. So option C is the wrong one, and option D is more wrong than option B, because in option D we are signing the form but resolve to raise concern from, like in option D we are signing the form but we will not um, obey what they are saying, that we will raise the concern if we want to, but we have also signed the form. This is wrong, that we are signing the form and we are doing what we want, but we are just signing the form. This signing the form is wrong mainly. So it is among the wrong one. It is the second least appropriate. Okay. And the most inappropriate answer is option A, which is obviously sign the form and begin the work as instructed. Okay.
Yeah, good. Okay, so the next sixth question is, you're on call and asked to prescribe amoxicillin for a patient complaining of pain on urination. The nurse has tested his urine, which shows the
Mm,
leukocytes and nitrates characteristics of UTI infection, urinary tract infection. Amoxicillin is suggested treatment according to the local protocol. So in this question, what happens is just the nurse uh, the nurse called you to prescribe amoxicillin, which is according to the test which nurse herself did it. So the question is this, the question in this is regarding the patient's safety and according to the following the protocol. So the most important thing is that so this is a problem, and the other problem is this, that patient do require medicine. So that is the two problems in this case. Option is, thank you, nurse, for being proactive and prescribe amoxicillin. Second is, prescribe trimethoprim as this antibiotic of choice according to your recollections from the medical school. Review the patient yourself and then prescribe if necessary. Reprimand the nurse for testing the urine without instruction. Explain that you will only prescribe antibiotics if the patient becomes confused and or hemodynamically compromised. Answer C is the best thing, to first review the patient yourself and then prescribe if necessary. And so
mm,
that is why you are just making the patient safety and also giving the medicine which is required in this question. And second one is,
yeah.
thank you the nurse for being proactive and prescribe amoxicillin. As amoxicillin is according to the guidelines and it is required by the patient, the thing is this, you should see the patient yourself first for prescribing yourself on the instruction of another. So that is not the good thing. So if you're prescribing something,
Mhm,
so you need to prescribe by your own thought and own knowledge rather than by some other. The other
mhm,
option, which is option B, which is prescribe trimethoprim as this antibiotic of choice according to your recollection for the medical school. So the first you need to know that in the hospitals in the UK, the first things we used to follow is the local guidelines even before the national guidelines. Every hospitals have
mhm,
made their own guidelines, so it is better for every doctor working in their own setup or own hospital need to follow the local guidelines. But as it is according to the local protocol, so that is better to give amoxicillin first, then trimethoprim. But in this case, somehow you are seeing the patient and you're giving the medicine which is required, but it's not according to the local protocol. So that is why it is in three. So other two wrong ones are, the next one is D, which is reprimand the nurse for testing urine without instruction. Though it is required for testing to have given by the doctor, but it's not solving anything, and nurse did his or her best to basically help with the patient. So but it is not solving the problem. And the E one is, explain that you only prescribe antibiotics. That is not even, you are not solving the problem. You are not giving medicine to the patient. I hope it makes sense, right?
yeah. And also in option D, there is also one problem, that we are like reprimanding the nurse. We are just lowering her confidence, or we are not being inclusive, that we should respect her suggestion as well. So that's why it is wrong.
Okay, that's
Yeah.
good. Okay, ji, so moving to the next, which is seven. So it is, you feel understaffed and undersupported when on call. Together with the FY2 doctor, you are responsible for all new medical admissions and welfare of around 300 ward patients. Attempt to raise your concern with manager, your education supervisor, and clinical director have been unsuccessful. So in this question, so there is a problem is that you feel tired and there is a lack of staff, and you need to follow a proper channel, and you at the meantime you need to maintain the patient safety and your work professionalism as well. So just follow the options and see which is the best one. Contact the medical director if necessary, the trust chairman. Option B is, document each stage of your complaint carefully. C is, contact a documentary program and offer to carry a hidden camera to capture specific problem. Write an article for your local newspaper raising concern about care of Mrs. Begins in the side room 4. Carry on and do your best whenever you on call. So problem in this is just you are understaffed, but you need to maintain a professionalism. Okay, and in the meanwhile, you have to
Hmm.
do something which are you facing, right? So first thing, forward your concern to the higher department as well. So the best option is this A, which is contact the medical director and if necessary the trust chairman. So you're following the hierarchy that you have already contacted the education supervisor, clinical director, which is unsuccessful. So you can contact on the higher, like medical director, and if necessary, the trust chairman. The second is document each stage of your complaint carefully. So in this case, make a list of what is the problem and what is going on, but it's
Hmm.
not really solve the situation. You're still doing all the work, everything, but you are overburdened and there is nothing you are doing in this case. And the next one is
Hmm.
E, carry on and do your best whenever you on call. So in this, you are doing nothing about the problem, which is itself a wrong. So these are the three.
Hmm.
So first two is a better. E is kind of a neutral, and you're doing nothing. So neutral, being a neutral is also a wrong thing in the good medical practice. So the
Hmm.
next, the two possible wrong, breaking the confidentiality. So there are two options. We are breaking one. Option C is worst, then the D. So the next is D. Write an
Hmm.
article of a local newspaper raising concern about the care of Mrs. Begins in the Route 4. So in this case, you are writing a newspaper about the Mrs. Begin, which are breaching the patient confidentiality. That is wrong. And the even more worse is contact a documentary program and offer a carry a hidden camera. This is
Hmm.
a even more bigger wrong thing you are doing is on a mass level. So that is even more worse than option D. So this is about 7. Which is question number 8. Your consultant knows that you are interested in a specialty and suggests that you attend a one-day course in another city and following week. You recognize that this would be a good opportunity for professional development. Unfortunately, you have no remaining annual leaves day and not entitled to study leave. The rota administrators say that you cannot have a time off to attend. So in this, there are one problem. So in this question, you are end up having a two options. One is follow your passion, another is follow your profession. So in this question, there is the real demand of any doctor. So there is one thing you like to do, and there another thing which you should do, which is the main gist of the SJT questions. So there is a thing you want to do, but there is a thing you should do. So let's move to the options. So
Hmm.
first of all is ask your SHO if she will look after the ward in your absence and go if she agrees. Speak your educational supervisor and with their support ask the manager for special permission. Accept that you cannot attend the course. Add up the number of days that you have worked late the week before and attend the course as you owed enough hour in lieu. Attend the course as you already have your consultant permission. So as I said that this is the what are your passion and versus your professionalism. So in this case, on the stamp it should be noted that so there is no you have don't have your annual leaves, you don't have any entitled to study leaves, and there is no rota manager said that you don't have any time off because of the what are the staff shortage or whatever the reason. So what is the best option is here? Best option in this here is B.
Hmm.
Speak your education supervisor and with their support ask the service manager for special permission. So you're trying to get but whether through the proper channel. So this is the only
Channel.
correct option. So this is the only correct options in this. And the next the other best another better option in this situation is as there is nothing which can be done is except that you cannot attend the course. Simple as this. Because no because the patient's duty is more important. That is your profession. You are a doctor and you need to follow the patient first. So C option is the second one that except that you cannot attend the course. And now there is a all makeup things that you're trying to make up for your trip. So the next one is slightly better option is A. Ask your SHO as she will look after the ward in your absence and go if she agree. So in this case, you are just trying to take advantage from another fellow doctor as you're trying to get a favor from her, despite she is having already having his her job. So better and is not a professional thing. How this is better than other two option is just you're trying to look up for the patient that if you want to go you're trying to make up for your ward. The other two options, the other other worse option is option number D. add up the things that you worked before and attend the course. As in this state, you're trying to make a basically make a little things for the able to go to the workshop, but this is the wrong way. As you know, this is there is no way you can go to the work attend the course as you already have a consultant permission. So in this way, you are just putting everything on risk and trying to attend the course because you want to attend the course, but it's not what your profession demand. Okay.
Mm, okay.
Okay, so moving to the next one, which is ninth. Okay, an elderly patient's daughter tells you that she is concerned about the ward care of her mother. She is thinking about writing a formal complaint and asks if she is overreacting and how best to complain. So in this situation, so there is a problem is that the patient attendant is concerned and she want to file a complaint, and she also giving you asking you some suggestion about his reaction. Is she overreacting or not? So this is a kind of a situation which every doctors feel, and see how you react. So what see let's see the option. Tell her that you will look into the things, but a formal complaint will not help. Suggest that she will drop into the patient advice and license service to see if they can offer. Explore her concern and try to clear up any misunderstanding. Let her consultant or a ward sister know that the doctor is dissatisfied and that a formal complaint might follow. Tell the doctor that ward nurse are particularly bad and they should complain. So better options and the few wrongs options. So the most important thing, as she is asking you, so better to ask her concern first. So best option in this case is option number C. Explore her concern
Mm.
and trying to clear up any misunderstanding, which make really sense before giving her all the bad options, trying to explore her concern first. Second is let all other staff members of your team should know that this is getting a problem and she is not satisfied. So D, let her consultant and ward sister know that her daughter is not satisfied. Then you can offer her that she might put a formal complaint at PALS. So B is a next better option. So these are kind of a correct answers, but in order of C, D, and B. But the worst answer are A. The other worst answer is tell her that you will look into the things, but a formal complaint will not help. So every patient has a right to make a formal complaint. So this is you are not doing her. You first thing you are making lie. Another you are not doing the best. You are not helping her with her issues. And E1 is tell the doctor that the ward nurse are particularly bad and she should complain. So in this case, you are just disrespecting your colleagues and your ward and hospital, which is against your professionalism without knowing the main cause of it. So better. So this is a worst kind of options. I hope this is like a clear, straightforward one, right?
Yeah.
Okay, so the next one is 10. You are reviewing the chart of a Tim, a young male patient with a previous anaphylactic reaction to the penicillin. The register has prescribed tazocin, which you note contain a penicillin antibiotic. The patient has yet not received the first dose. So in this case, see there is two problem is there. One is the wrong prescription of penicillin, but other thing is that your senior has mistakenly write the penicillin, but it is your duty. If you see anything wrong, you have to do what you can do to solve the problem. So just go to the options, strike out the prescription and let the nurse know that it shouldn't be administered. B is complete a clinical incident form. Speak the registrar to alert him or her to this error. Ensure that allergy is recorded clearly on the drug chart and in this patient notes. Amend the prescription and do not cause a fuss and no harm was done. First thing is patient safety is the most important in every situation. So as the patient is about to get an penicillin, so you need to make sure the patient is safe. The best answer according to this is A. Strike out prescription, let the nurse know that it shouldn't be administered. So in this case, you are just striking the prescription and also letting the nurse that she is should not get the penicillin. So that is the most accurate option in this situation. So the next one is amend the prescription but do not cause a fuss as no harm was done. So this is the little tricky one to just say. So this is not a complete, you can say a form of incident. So this is
Mhm.
we need to clear this. This is not an incident. Incident is where the wrong thing has done, and then you write the incident form. Okay, so do we need to
Okay.
know this, where we only write the incident form when it is occurred. So this is not an incident if it is written incorrectly by your senior, and if anything doesn't go bad, so it is not a incident yet. So the second option should be E rather than B. Amend the prescription and does not cause a fuss as no harm was done. So this is the second one. The other
Mhm.
one is ensure that, and now you're making things. So this is the two which is clearly state the problem. Next one is D, which ensures that no future this kind of reactions will happen, but it really do not currently help with the patient. So this is the third one. The next other two are the C one is better, to just ask the relevant concerned person, which solves the problems immediately on at the present. The last one is filling the incident form. This is the complete process. The governance meeting will held up, finding the root cause, and it will really help maybe in the future, but it is really not indicated in the present situation. So this is the last one in this situation.